58-year-old patient with breathlessness is seen by Dr. Susan in the emergency room. The patient is nebulized with albuterol and budesonide. On examination, the patient is conscious and oriented. Vitals are stable. General examination is within normal limits. There are severe rhonchi in the left lung fields. Air entry is decreased in the right lung fields. Other systems are within normal limits. Dr. Susan orders for CBC, serum glucose, renal function test, liver function test, tox screen, ABG, chest x-ray, serum sodium, and serum potassium. Dr. Susan notices a change in the ECG tracing to ventricular fibrillation. CPR started and Dr. Susan took the lead. 30-to-2 ratio. 30 compressions followed by 2 ventilations. 30-to-2 is 1 cycle. You have to complete 5 cycles in 2 minutes. High-quality CPR performed. Push hard and fast with minimal interruption. Compressions should be between 100 to 120 per minute. Allow complete recoil of chest wall. Compression depth should be 5 centimeters. Avoid excessive ventilation. Change compressor ventilator every 2 minutes. Since the rhythm is VF, Dr. Susan asked to give a biphasic shock of 200 joules. Dr. Susan asked Dr. Patrick to obtain an intravenous access. Intravenous access obtained. Second shock of 200 joules delivered after 2 minutes of CPR. Now, Dr. Susan asked to intubate the patient. Injection of epinephrine or adrenaline, 1 milligram IV given. After intubation, chest compression between 100 to 120 per minute. The ventilation should be about 10 per minute. All the test results come to be normal. The 5 H's and 5 T's of cardiac arrest: hypoxia, hypothermia, hypovolemia, H+ ions or acidosis, hypo or hypokalemia. 5 T's include toxins, thrombosis cardiac, thrombosis pulmonary, tension pneumothorax, tamponade cardiac. Third shock of 200 joules given. Hypoxia, hypothermia, and hypovolemia is already ruled out initially during the presentation of the patient to the emergency room. Hypo or hypokalemia and acidosis is ruled out by ABG. Initial tox screen ruled out any toxins. Now, Dr. Susan asked for D-dimer, echo, and a portable chest x-ray for the patient. Injection amiodarone, 300 milligram IV given. Chest x-ray reveals pneumothorax in the right lung field. Dr. Susan asked for an emergency needle thoracostomy. Dr. Patrick performs the thoracostomy. Now, the ECG shows a sinus rhythm. The patient is sent to post-cardiac arrest care unit. During the management of cardiac arrest, always try to figure out the cause.
This is Dr. George, and thanks for watching.